is your program of choice, Health Affair on AIT, a platform where we focus on public health issues, challenges of women and children with a view to offering lasting solutions. I am your regular uncle, Ushuomowa Daniels. 1 million Nigerians die of invasive fungal infection annually, according to health experts. Despite the seriousness of the threat of invasive fungal infection, not much awareness and attention is given to it by the Nigerian government. This is the focus of our discussion this week. Please stay tuned as we take you through our news segment. It was a briefing with health journalists on a case study that examines digital and financial inclusion of community pharmacists across the country, coming at a time when access to healthcare funding is a major challenge in the sector amidst high cost of essential medicines and healthcare services. The president of the Nigerian Medical Association, Professor Bala Audu, represented at this forum by former NMA chairman Dr. Benjamin Olowojebutu, applauded the initiative.
The access to healthcare right now in Nigeria comes more for community pharmacists and say that this research will go a long way to improve access to healthcare, especially funding, because in the next few years, if you don't think out of the box, there'll be a lot of problems in funding healthcare. And I hope the questionnaires are going to be robust, so you're not just limited to few areas.
Apart from improving access to healthcare funding, speakers believe it will also address the problem of counterfeit medicines in circulation.
Having access to medication and funding in community pharmacy is just like a collaboration, because they have seen the challenges we are facing in community pharmacy practice, and they decided to do a research on that and know how they are going to bridge the gap.
We also appreciate ACPN for the opportunity we have to collaboratively carry out this project. And we are not relenting. We still have more products to launch into this space.
One thing we realize is community pharmacies are so widespread in Nigeria, and they are like the first point of call for accessing healthcare in Nigeria. And we've realized that, hey, these guys have been using our services. What more can we do in terms of advocacy, in terms of improving our services?
Community pharmacists are healthcare professionals responsible for dispensing and distributing medicines. The scope of their healthcare responsibility became wider during the COVID-19 pandemic outbreak and shortage of manpower in the sector, occasioned by increased migration of more healthcare professionals for greener pastures. The Bill Gates Foundation has tasked world leaders to increase global health spending where it is needed most to boost children's health and tackle malnutrition. In its 8th annual Goalkeepers Report titled A Race to Nourish a Warming World, it was noted that without immediate action, an additional 40 million children will be stunted and 28 million more wasted between 2024 and 2050. While recommending that scaling up solutions now can avoid the predicted outcome, the need to build resilience to climate change and spurring much-needed economic growth also came to the fore. In 2023, the World Health Organization (WHO) estimated that 148 million children experienced stunting, thereby risking growth to their full potentials mentally and physically. About 45 million children were also reported to experience wasting, a condition where children become weak and emaciated, leaving them at a greater risk of developmental delays and death. To alleviate the suffering of the masses amidst the worsening economic hardship in Nigeria, some kind-hearted individuals have called for a continued support by way of providing palliatives. They were speaking during the distribution of food and other gift items to some Lagos residents.
Because there is hunger and there is this inflation that is going up and down, that is why my company decided to do this to help reduce the hunger that people are feeling. My advice to all Nigerian people is that they should try to help anybody that is in need.
It's a good thing for you to share to the less privileged and to those that it's hard for them to get. So it's a privilege. I'm so happy for what I'm doing right now.
These caring Nigerians also extended their magnanimity to an orphanage home in the area with food items, toiletries, and cash gift of about 400,000.
So that they can have something, so that people will see us and know that they need to do charity to people that are in need. We decided to go to charity home and share some things to them.
We really appreciate, because that is what God said we should be doing, to give out to the less privileged. So, the Bible says we should give the orphans, the widows, and those who are in need. So really appreciate.
Many Nigerians have continued to live in abject poverty and unable to afford their daily meal, especially with the increasing price of petrol and weakening strength of Naira against the dollar. Pharmacist Anthony Ahemie, former president of the Pharmaceutical Society of Nigeria, PSN, has bagged an international award of excellence. Pharmacist Ahemie, among other 10 recipients, were presented with the FIP Fellowship Award at the just concluded World Body of Pharmacists Congress held from 31st to August 5th, September 2024 in Cape Town, South Africa. The Director General of NAFDAC, Professor Mojisola Adeyeye, and President Pharmaceutical Society of Nigeria, Professor Cyril Sifo, were granted to celebrate with them. Welcome back. Invasive fungal infection are systematic infections resulting from the establishment of yeasts or molds in deep-seated tissues. They are fatal conditions with high rate of morbidity and mortality, especially for persons with compromised immunity. Listen and learn more about fungal infection from speakers at the Second International Conference of Medical Mycology Society of Nigeria. It had as its theme, Interfacing Medical Mycology and Public Health. Where are we? Invasive fungal infections are systemic diseases resulting from the establishment of yeast or molds in deep-seated tissues. They are fatal conditions with high rate of morbidity and mortality, especially for immunocompromised patients, making it an issue of concern at this forum of International Conference of the Medical Mycology Society of Nigeria.
In 2013, we estimated that 11.8% of Nigerians were at risk of serious fungal infections. By 2016-2018, we discovered we underestimated. So these are infections that some of them are very simple. You know this lakpa you see on children's those map, those are fungal infections. We call them dermatophyte. Some people you see my bus conductor, big mark on the body. Those ones are not life-threatening. Women, they have vulvovaginal candidiasis. It keeps coming and going, coming and going. At least 50% of women in their lifetime, we have at least one episode of vulvovaginal candidiasis. That one is not life-threatening. But there are people like the HIV patients that have advanced HIV disease. Cryptococcal meningitis will kill him. You heard stories about very low birth weight, small babies. Candida infections kill them, invasive candidiasis. It kills, it's life-threatening. You have heard about molds, okay? Like aspergillus. It affects people that have chest problems. They have cavities in their lungs. Or people that have cancer and they are treating them for cancer. Because of that, all the cells in their body that fight infection have disappeared or have reduced significantly. They are at risk of invasive aspergillosis, and that one will kill. Chronic pulmonary aspergillosis, the TB patient that have cavity, after they have treated him for TB, is at risk of chronic pulmonary aspergillosis. The doctor needs to know and prevent it. If not, he will develop that, and in a space of 5 years will be dead. So these are life-threatening infections. It's silent. Candida auris, there's a pandemic going on. It has been reported in practically every continent. In Africa, we have reported in about 6 African countries. It's not that they are not seen. It's to have the capacity to make the diagnosis. We have seen outbreaks in Lagos here. We are looking for which we have seen also in Benin. And we have reported all these things in literature. These are multi-drug resistant pathogens, interventions in the country. So that we also have resistance emerging. You know, you have been hearing a lot about AMR, antimicrobial resistance, is a global problem now. We need to ensure that fungal infections are inside there, because we also have resistance to antifungals emerging, and we don't have the drugs in country. So once we put it center, the relevant authorities will then make the right policies that will prevent deaths from fungal infections in the Nigerian population. So it is important that we know this problem. You know, when you get to your house, how do you know that the roof is leaking? You see mark on the wall, right? You say, this place is leaking. No, that is a mold growing. Because mold likes dead, decay material, likes moist places. Okay, so that is mold. You see all this refuge dump that sometimes you see the refuge is covered with black thing. Then children are playing, they kick ball there. The thing you see something, you remember them now. All those are molds, they are the spores. When people inhale them, they can go to the lung and cause damages. They can spread to the body. So you have things like invasive aspergillosis, chronic pulmonary aspergillosis, candida, which can cause both superficial infection and the one that kills people. You have mucormycosis. Diabetic patients are the ones that are most at risk. Even then, you have people that have defects, ENT surgeons, they see a lot of them. Many labs, many hospitals don't have the capacity to diagnose them. They don't have the tests, the diagnostics available to make this diagnosis. And even when they have, which is unlikely, a lot of times, a lot of doctors don't know about it either. So if you listen to some of those stories, it was when the patient had died that they found out. But it is preventable. We need to build capacity. We need to provide the diagnostics. And as you heard, Nigeria Center for Disease Control, the NCDC, has now incorporated it into the action plan for the country going forward. So we hope that we'll see less deaths from this infection. We estimate that it will kill at least 1 million Nigeria every year. Nigerians is that one we need to know, and then so that we can also be aware there's not a patient when they have relatives that have cancers, have HIV, they have diabetes, they have very small babies, newborn babies and all, that they are at risk of this infection, so that they can be on the lookout for it. In India, they are having multi-drug resistant ones. It cannot be treated, and it's spreading globally. So we don't have so many drugs. We need to make sure that we make the diagnosis early enough and treat these patients. So they need to make sure they get lab tests done.
Mycology in animal health practice is a huge problem. First, we haven't gotten diagnostic capabilities where fungal infections in animals are being diagnosed. Unfortunately, most of these fungal infections are in food animals being consumed by humans, and thereby impacting more public health issue. It is very costly in management, and therefore antifungal resistance in animals is even worse a problem than in humans, due to a number of reasons that we keep bombarding these animals with antibiotics without having a specific diagnosis that has to do with the fungal infection. Fungal infection, particularly in animal health practice, should be pursued to its logical conclusion, and this is one infection that we are likely going to miss, so it must be pursued to its logical conclusion in terms of seeking empirical evidence, getting diagnosis right, and then also pursuing the medication. It's one group of organisms that we should not resort to self-medication. We have to have a regimen monitored by a health expert or a veterinary doctor on a farm.
And when you bring to the issue of food, you need to buy and consume in the market food safety and fungal infection. What's your advice to our government about regulating all those things and people who buy to consume?
Okay, so the hazard analysis and critical control points when it has to do with the food we take from animals need to be screened for, and it need to be I mean, when you talk about the hazard analysis and critical control, it needs to be for issues of fungal infection. Very recently, we had outbreaks of fungal infection in dairy farms, and eventually you and I know that it will be passed to humans, because the humans will naturally consume milk, and it is a very dangerous trend, and Nigerian government will have to strengthen the capabilities of veterinary doctors so that we can nip some of these problems in the bud. Thank you.
Need for more awareness. People should be aware and should be able to differentiate all forms of infections. People should know what symptoms, especially healthcare workers, what symptoms, when they should suspect, fungal infections, so that they can use laboratory to actually confirm whatever diagnosis they are thinking for rational use of either antibiotics or antifungal agent. So awareness is very key, and with this project and in collaboration with NCDC, we are looking forward to integrating antifungal stewardship into our national integrated antimicrobial stewardship program.
In last 2 years, what I observed in Nigeria, that the burden of antimicrobial resistance in Nigeria is the topmost. You can say that it's the topmost reason for the number of deaths which are happening in Nigeria among all the infections. Either you take HIV, even TB or malaria or enteric or typhoid fever. So we have seen that in 2019, around 265,000 deaths are associated with bacterial antimicrobial resistance infections. But that is not, there is no data to really advocate on fungal, antifungal resistance infections, because we have really inadequate surveillance system. So the data is not really been captured at the hospital levels, and it is not been submitted to the HUNET, which WHO actually recommend to use at a hospital level, where the specimens are tested for antifungal infections. So they need to use that, and then we can be able to really make a very high level case for Nigeria to really support this antifungal resistance as a big public health problem, because we have seen a lot of cases of Candida auris and Candida albicans, but they are all isolated examples. To have a big picture and a national picture, we need data from all the sides. So there is a need to expand surveillance for antifungal resistance strains in Nigeria, and I am happy that I can see the Professor Iruka, Professor Rita, and the Luth. They are taking this leadership in this, and we all are together in this journey to really help Nigeria. So my message to all Nigerians specifically, because we all working for really in control of reducing the impact of AMR, because AMR not only affect the deaths or health sector by means of increasing deaths and morbidity, but it also affect the economy and the development aspects in the country. It has affected directly the gross domestic, the gross domestic products (GDP), and also affected the productivity in terms of loss of human lives, animals, and environment. So it has a big implications. So we also would like to promote that there is an approach called One Health approach, which we should also adapt. So we all are working together, and now there is a very clear plan of how to support this One Health in Nigeria, which actually address AMR and other One Health threats which we have. But we are here to support this antifungal resistance. It's really a challenge, and we as WHO support the country in terms of supporting, strengthening the surveillance, which is called GLASS, and we have a separate fungi module where this has been launched this year. So I presented in my slides that how country can submit data through that fungi module. And also we are having the AMR diagnostic initiative. Under that we are also promoting and supporting the lab capacity.
If you are just joining us, Health Affair on AIT, and next on the program is a nutrition segment. That aspect of the show that's concerned about you eating right to stay healthy.
Locust bean, commonly called Iru in Yoruba, Ogiri in Igbo, and Daddawa in Hausa, is a local seasoning used in preparing soups and stews. It can also be referred to as the African locust bean, with the botanical name Parkia bigiobosca. The locust bean can be found in a wide range of environments in Africa and is grown for its pod that contains both sweet pulp and valuable seeds. Research shows that locust bean helps to promote good eyesight and aids in treatment of health conditions like hypertension, stroke, diabetes, anemia, and malnutrition. Consuming a good amount can equally reduce fever and boost the immune system. The most valuable part of the locust bean is high in protein, carbohydrate, fat, calcium, and other vital nutrients cherished by the body. Consuming locust beans is good for your health.
This is where we draw the curtain on the show this week. Thanks for spending your time with us. Let's do it again same time next week. I remain yours truly, Ushuomowa Daniels. Please keep staying safe.